Okay.
Thank you all for coming, taking the time on a Friday afternoon. I know the leaves are turning. You'd probably rather be out moseying around. Really glad you took the time to be here this morning. We do have kind of a packed agenda, and we're going to get started in a minute after I do a couple of announcements. On the agendas at your tables, you will see Samantha from Dalio Foundation. She is unable to attend this morning, childcare challenges, but she and Chris Liddy have read our report and our plan, and we're going to be meeting with them to look for the alignment between the Dalio report and our plan. Just wanted you to know that. I am going to take a minute and introduce Raheem Nelson. And would you say you're a graphic artist, designer? Graphic recorder. So some people are auditory learners and some people visual. And so we have Raheem here. He's going to do some visual documentation for us. So you'll be able to observe it live. And if you don't mind, I'm going to read a little bit of your bio. Thank you. That lets me in. Okay. Raheem is an artist based in New Haven. He went to the School of Visual Arts, completing his education with a BFA in cartooning. He has a background in traditional cartooning and oil painting. Currently, he creates his personal and professional work on an iPad, which is kind of unbelievable. And he specializes in graphic recording, portraits, and pop art. His work has been featured on NFT New York City 2023, Arts and Ideas, the Shops at Yale, New Haven Cultural, I probably didn't say that right, the Arts Council, and the Thai Bar, and Power to the Patients. So, welcome and thank you, and feel free to watch as the morning unfolds and he captures what we're talking about. Okay. By the time you leave here today, with all of the different activity, we want you to feel informed, inspired, and an integral part to the work that we are going to be undertaking together. So just know that you're here for a purpose. You were personally invited, and your voice, your experience counts. Good morning.
Good morning.
Edna. All right, so we're going to kick off. Senator Kissel is going to make some remarks because I know you have to head out quickly. And then after Senator Kissel, Kate Bailey from Initium Health, the consultant that did the planning process with us, is going to take it from there and do an overview of the plan. All right, Senator Kissel.
Thank you, Cindy. Good morning, everyone. Great to see you. TGIF, right? It's been a busy period of time. I am so honored that they allowed me to say a few words at the beginning of this presentation. And again, I apologize for having to zip out after the first couple of speakers. But I thought this was really important. Over the last several decades, where I've been so honored and privileged to be your state senator in Hartford, I have seen things come to the fore that had not gotten the attention that they really deserve. I remember about 25 years ago, we grappled with Alzheimer's. That was a problem that was afflicting our seniors, and it was something that families really didn't want to talk about not that long ago. This was something afflicting grandma or grandpa, and they sort of kept it in the back. And now that issue was grappled with when I was on the Select Committee on Aging, that's now a full committee, and we're not hesitant to talk about trying to get a cure for Alzheimer's. And people in the legislature know the needs of folks that are afflicted with mental illness in their senior years. And Alzheimer's isn't just for seniors either. It does afflict people of all ages. Similarly, probably 10, 15 years ago, there was an initiative and we were starting to get our arms around autism and kids on the spectrum. Whether that was because the medical community was making that determination more and more, but part of it was getting my fellow legislators, Republicans and Democrats alike, in the House and the Senate to just be sensitized to the fact that autism was a very important issue. And I remember at a Starbucks here in Enfield, sitting down with two women from Suffield who were leading a charge regarding that because they had children with autism. And they said, hey, listen, no one's really aware that this is really a huge issue. And we started nibbling and nibbling and nibbling, and now it's just not uncommon for people to be sensitized to the needs that are out there and trying to get our arms around why are so many children now being diagnosed as having autism and being on the spectrum. So there's lots of issues like that, and this is a new one, but it's one that's always been there, right? Loneliness, isolation, and the ramifications that that has. And I'm so excited that everybody in this room is going to learn about that this morning and think about ways that they can jump on this issue and highlight it. But the first step with everything that I have found as a state senator and as someone who loves this community in North Central Connecticut is awareness. And I analogize it to when I would try to reach out to my constituents. At first I would just go and have town hall meetings, and I would say, I'm available to answer questions. Well, I'd be lucky if I had 2 or 3 people in a 2-hour period that would stop in. And it wasn't that we didn't promote it, it wasn't that we didn't have it on all the news, but people have busy lives. They have their days, and it's hard to get people to go out of their cycle of routine to stop in. So then I changed it to Senator on Your Sidewalk, where I would just camp out in front of ShopRite or some Geisler's or someplace, depending on the town, and just try to access people as they were going about their daily business. And all of a sudden, the number of people that as they were getting groceries or picking up a spouse that was getting out of work or something like that, I was hearing from lots and lots of people, and they were telling me what's on their mind and how I could introduce this bill or kill that bill. What I'm saying to you today is the first step is awareness, and you guys are all about that, or else you wouldn't be here. But secondly, it's going to be what are the creative ways that we can help with this? And it is not just a certain age group. I had the great honor to sit down with 3 of my superintendents just a couple of days ago from East Granby, Granby, and Suffield. And one of the things that came up was discipline in the school system and the fact that law enforcement has to be called more and more. And, you know, folks in Enfield might think it's sort of, you know, an Enfield issue. No, it's not. This is something throughout my district and throughout the state of Connecticut. Well, why is that the case? And at least according to these superintendents, part of it is the evolutionary change that has occurred in society in a variety of ways. And I'd be the first to say, I think that the pandemic brought a lot of these issues to the fore, but they were percolating underneath for a long time. And the pandemic sort of raised the visibility of a lot of mental health issues, and loneliness and isolation was one of them. And part of it is because the nuclear family has somewhat disintegrated across the board. It's very rare now to have like kids helping their grandparents. Not everybody lives so close. In fact, sometimes I'm surprised that people that have retired to Florida or South Carolina, they come back to New England, to a high-tax state like Connecticut. We ask them why, and they go, I don't want to be away from my grandkids that long. So the natural desire is to be close and intimate as a family. And then, on top of that, you have technology. And technology has allowed us to do so many great things, but it has also allowed us to camp out in our bedrooms, in our basements, in the corner of the house, and just sort of be glued to that cell phone or to the laptop, and you don't really worry about being out and intermingling with other folks in society. That can have great ramifications, but it can also have extremely deleterious ramifications. You know, I talked to my youngest son, who's 20, Tristan, and I said, when I grew up, and he looks at me with like a little, I wish I knew what it was like in those days, and it's not that long ago, as old as a git as I am. We would just look for the lawn with all the bikes in front of it to know where all the kids were hanging out. Well, kids don't do that nowadays. They will communicate, but they're communicating from their various pods, their various homes, their various hangouts. When I drive home sometimes, I will see kids on Franklin Street or through where I live or something like that, and they are hanging out, and in my day, it would be like almost like gang-like, but they're all glued to their phones. And I go, well, I guess I'm not really worried about them getting into trouble, but also they do get in trouble in their own ways. And so we have to figure out ways to make it easier to break down the barriers and to break the new routines that have encroached upon our world. And make no mistake about it, it's very important to our mental health and our health as a society and as communities to do this in a way where people don't run away. I know that if someone said to me, John, you got to get out and mix with more people, I'd be heading in the other direction. Don't tell me what I got to do, and don't push me into some place where I have trepidation. I wouldn't call it fear, but trepidation. I feel nervous about going and meeting with new people. Believe it, I still to this day. This doesn't come naturally chatting with people. I am not a hobnobber. And most people aren't. So there has to be ways that you will come up with that are creative to bring people together where you're sort of doing it without them even knowing. Secondly is, it does affect all age groups. I know that when you're sort of like in middle age, you're running around, you're balancing jobs, maybe you're taking care of your parents, you're taking care of your kids, and you're probably wishing, please, I wish I could be lonely for a few minutes. But for so many other folks in our society, in our families, in our communities, it's just not that healthy. And so for our young people, I felt bad during the pandemic. How do little kids know if they're making friends with another little kid if they're all wearing masks? You don't know if that little kid is smiling at you. And we're gonna see that trickle through our education system and into society for years to come. And we're starting to see some of that evidence already now. Also with our seniors. I had a flat tire this week. It really stunk. I couldn't meet with my youth council friends and go meet them at the Capitol. Carol knows I had to cancel that visit. And all of a sudden, like when you take away your wheels, it's just like if you're a senior and they take away your license, you realize I'm grounded. That was the big punishment when you were a kid. You're grounded. That's the worst thing. When we were talking about what's the penalty for marijuana when we were legalizing it against what I thought was in the best interest of society, but I lost that fight many times over. We said, well, what do we do if we're not going to put people in jail for marijuana, but they're underage? And throwing people in jail is not always the solution. For hardened criminals, yes. But what do you do with someone who's underage? You take away their license. Because that's the worst penalty that can happen to someone as you ground them. And so how do you break through that, especially for seniors? Because I know my mom just passed this last year, but she was 90, and the big deal was getting the mail from the neighbors because she couldn't get out to the box. Or, we talk about Meals on Wheels, and we strive to have nutrition for our older people, but a lot of it is just getting that visit. Guess what? The food is important, but the visit is what's even more important in many respects, but it's sort of camouflaged, right? The whole notion is, I'm getting food, so no one feels like they're asking for help, but they get to chat with whoever's bringing it. And that is just as important. Social interaction is the food that we all live on. And they've even done studies that people that are isolated tend to gravitate towards addictions more than people that have social interaction. So I just wanted to be here to say, I think you're doing something incredibly important. Every bit as important as bringing awareness and addressing issues of Alzheimer's or autism. This is a new, huge ticking time bomb in our society. And we need to break down the silos, just like Carol and I and others in government like to break down the silos of government so that people communicate and talk to each other so that we can serve the people better. It's the same way with all you great folks, Cindy and Amy and everyone else in this room that's working on social services and interaction and mental health. You guys are at the cutting edge, and I wish you all the very best. Thank you, and God bless you all. And yes, I am long-winded. And now it's my great delight to bring up Representative Carol Hall to say a few words. I passed it by Cindy, and she said it's okay.
Thank you, John. I won't be as long-winded. I'll make it short and sweet, but that was wonderful. Thank you. I'm here today, and it's a great honor and a privilege to be here. And I want to say a little bit about the group and the folks in this room. Years ago, and many of you know, my husband served on this coalition. And he's actually a man of very few words. He would talk about the group, and these are the words he would use to describe this group. They're an amazing group of people. They're loving and caring. And for him, he's an extremely religious man. He actually said they're doing God's work in this group. And if you know anything about my husband, that's probably about the highest praise you can get. It's groups like this and the people that sit in this room, these grassroots organizations, that really secure change. Because let's face it, at the federal and state level, we can fight for things, but it doesn't always happen. And at this level and this group, you actually are the change people that make those changes realities. And I use, years ago, you look at the Mothers Against Drunk Drivers. Think about that group. It was about 30 years ago, roughly, that organization was put together. And because of their efforts at the state and federal level, we have less fatalities on our roads today. It's not because of what the federal government did, and it's not what the state legislators pass. It's actually because of people that are in this room that make the change. So I want to thank you for inviting me. I'm here to listen. I didn't plan on speaking today, but again, thank you for everything you do, and God bless the work that you bring to all of us. So thank you.
Great, thank you so much, and good morning. Good morning, everyone. My name is Kate Bailey, and I'm a partner with Initium Health. I've had the pleasure of working with the town of Enfield for a little over a year now, and I led the strategic planning process for the Mental Health and Wellness Coalition. And I'm so overjoyed to be in the room with you today to take you and support you to the next phase of implementation and really see what was just a plan come to life. So my background and expertise is in public health. I spent the first half of my career inside of hospitals and health systems, helping them think about how to work with their communities from a healthcare perspective. And now I've been consulting for about 8 years, and I work mostly with local governments who are tackling complex health issues and helping them to work with their healthcare partners and the myriad of other stakeholders that they need to work with. Much of my work is focused on mental health and substance use prevention and treatment, because communities like yours across the country are grappling with the same issues. And you know, it's not just a healthcare issue or just a public health issue or just a public safety issue. It's all of the above, right? It stretches into education and workplaces, neighborhoods, parks, community centers, and churches, affecting us and our families, our friends, our neighbors, and our fellow citizens, which is the reason we're gathered here today. So you have an agenda there, so I'm not going to walk through it just for the sake of time, but I will kind of reiterate what Cindy said at the beginning, is that we are connecting all of these pieces today. So what's work that's going on at the national level, work that's going on at the state level, and work that's going on right here in Enfield, and you'll see how that all ties together. So Initium Health, we're a public benefit corporation, which aligns us well with our public agencies that we serve. And here's a little bit of our leadership and our expertise. So we do everything from strategic planning and health assessments to community engagement and even public awareness campaigns, as we promoted 988 for the state of New Hampshire. And the work that we're doing here today really builds on a strong foundation of an amazing department of social services that you have here in the town. Out of this department, we have case management, not only for youth, but for everyone from infants to seniors. We have the crisis response team, we have the family resource center, we have the youth center, and so much more. So I'd just like to take a moment and recognize the management team at the Department of Social Services. They were not aware, so, but if you could please stand or wave when I call your name. We have Karen Edelson, the Senior Operations Manager. Amy Morales, Operations Manager for Child, Youth, and Family Services. Joanna Fornwalt, Clinical Care Coordinator. And Andrea Machek, Grant and Performance Manager. And I'd also like to recognize Tessa Riddell, Prevention Coordinator and Advisor to the Youth Council, who has done a tremendous amount of work in preparation for this event. So the ETC Mental Mental Health and Wellness Coalition is a collaborative group of cross-sector representation, as we have here in this room, of those committed to substance misuse prevention and mental health promotion of Enfield residents across the lifespan. It was formed in 2004, and in 2005 launched the first youth survey. And it was formed, I should say, on the heels of some tragic losses of students who had overdosed on prescription medications. ETC received its first round of drug-free communities funding, federal funding, in 2012, and then another round 5 years later in 2017. ETC was awarded a CARE grant from the CDC to specifically focus on opioid use prevention in 2020. And then in 2023 is when we conducted the strategic planning process for the Mental Health and Wellness Coalition for all ages. So the North Star for this group is that all Enfield residents are healthy, safe, and stable, and connected to their community. And how important is that, as we've already heard today. So I wanted to reflect a little bit on the strategic planning process. We had community input from such a wide range of stakeholders. We held focus groups and interviews. I personally went down to the food shelf and over to Loaves and Fishes and got to meet with some folks there. And as you can see, we had a lot of participation in putting this together. A lot of the voices in this room, thank you for your input and your participation in the process, which resulted in a strategic plan, and you have the executive summary there on the table with you. This strategic plan was now shared with the other folks that are working in this space. So the U.S. Surgeon General's office, who we'll hear from today, with Senator Murphy's office, and with the Lieutenant Governor for the related initiatives that were cited in this report. And excitingly, you're going to hear from them today as well. So I just want to walk you through something very exciting. If you kind of look at this timeline, it all converges, and it illustrates how this work in the town of Enfield connects in to the work that was going on at the same time. So in February, it was when the request for proposals, or RFP, for the strategic planning process was issued last year. And then in May, the advisory from the U.S. Surgeon General's office was released, highlighting our epidemic of loneliness and isolation. You may have heard of that because of that alarming statistic that was highlighted in the report, that experiencing loneliness is as detrimental to your health, your physical health, as smoking 15 cigarettes a day. Now, we've all been well educated in the effects of nicotine and tobacco on our bodies, so it's easy to kind of picture that. Wow, that's loneliness would have the same effect. It's kind of mind-blowing. Good morning. And then from August to December is when we conducted the strategic planning process, and then in December was when the SILO Act was introduced by Senator Murphy. In February of this year, the Lieutenant Governor's Social Connection Campaign was announced, and then in April, the leadership work group for this coalition convened. And that brings us to today. So as you can see, the work that you're doing is connected and supported, and we don't have to reinvent the wheel, and we can learn from a lot of work that's being done in other communities. So developing a shared language, just wanted to go over this a little bit because we're going to be hearing these terms and using these terms a lot, and there's a little bit of nuance in between them. So when we talk about social isolation, it's really something that's objective, that we can measure. We can count things. We can count numbers of relationships. We can count numbers of activities and see if somebody is, experiencing social isolation. However, loneliness is more subjective, and that doesn't make it any less real. I just mentioned that it has such a deep impact on our physical health. However, it does make a difference in how we measure it and how we think about it. So loneliness is when you feel distress because your social connections do not meet your personal needs or expectations. And then this term social connection, this is encompassing both the range and quality of your social network, including the number of people, the roles they play, and how positive or negative those relationships are. And hopefully they're positive. So as I mentioned before, and you'll hear about a little bit, I wanted to lay the groundwork for all these other initiatives that are connected in, is this SILO Act, so addressing social isolation and loneliness in older adults. Now we know that it's not limited, these issues are not limited to older adults, but this act was specifically looking at this group, particularly coming out of the pandemic. A lot of people's lives had not returned to normal, especially for older adults and those who had experienced severe social isolation and loneliness. So this act will support outreach to at-risk individuals, community-based interventions, and connecting at-risk individuals with social and clinical supports. And then we have the Connecticut Social Connection Campaign. So this is looking on an interagency basis across all state agencies to say, okay, what are we doing around social connection and how can we work together? How can we connect the dots? How can we work beyond state government with groups such as yourselves, such as those that are represented in the room, to identify gaps and opportunities and ideas related to improving social connection. So a statewide effort, really notable work. And then finally, the work I want to highlight is this from the U.S. Surgeon General's report, the 6 pillars to advance social connection. So the same report that mentioned that loneliness is as detrimental as 15 cigarettes a day also gave some guidance to how communities can advance social connection. And as a group, as this coalition moves forward, we'll be moving through many of these, hopefully all of these pillars. Right now, we're kind of focused in on number 1, strengthening social infrastructure in local communities, and number 6, building a culture of connection. You know, when we think about things like cultivating values of kindness, respect, service, and commitment to one another, these might seem like soft things. But as we know, most things are caught and not taught. So as we model these values, they'll continue to be caught by those around us. And it can really make a difference in terms of people feeling connected to one another when they experience these values in action. So it takes all of us, right? We know that the reason that we're gathered here is because this work can't be done alone. It can't be done by the town of Enfield alone. It can't be done by us Nantucket alone. It can't be done by the school board alone. It really does take all of us working together because all of us are affected. So some of the major themes that we found from the strategic planning process, you know, we went broad thinking about mental health broadly, and this is where we arrived, was looking at, you can see this, the lighter blue box there, a collective call for increased connection was one of the main mental health topics that rose to the surface from all those focus groups and interviews. Barriers to vital resources, trying to get to the things that actually exist. Misconceptions on mental health. Oh, someone hasn't come out of their house in a week. Is that mental health? One of the comments or questions that we heard. Housing and mental health, the connection between having a safe and stable place to live and having good mental health. So these were our 4 major themes when we looked across everything that we heard and what it kind of boiled down to and where we thought that this coalition could have an impact. So real quickly, I'll just highlight our priority focus areas, looking at a needs assessment of what's really going on with this resource issue. And what's really going on between the person who needs the resource and the getting to the resource and getting to the root causes of that. Community engagement programs and events. You know, what are the things that we can do together that will bring people together in ways that they enjoy? Mental health literacy campaign. How can we elevate people's understanding of mental health and how that we all have mental health, right? We all have physical health, we all have mental health. But where are you with it? How are you doing? And then long-term advocacy. We know that housing is such an intractable issue and so difficult, but we believe that you cannot let up. So advocating for housing initiatives and funding for programs to allow more mental health support and social services. Oops. And at this point, we'd love to invite you to take out your phone. A little interaction here. We're not going to break you into groups and have you talk, but if you can take out your phone and go ahead and scan that QR code, we'd love to hear a little feedback from you. All you have to do is scan the code and touch your screen, and this should pop right up, and you'll be able to select your answer, and then hit the button at the bottom, and we should see it pop right up on the screen. So which of these issues resonates most with you? We know we have a variety of perspectives, experiences, professionals in the house, and would love to just hear kind of where you're coming from and what connects with you in terms of your perspective, that maybe the people you serve, maybe the people around you who are being affected. So I can see the answers are rolling in right now. If you don't mind just completing that, I can see everybody's doing that. We'll just give you a second. Thank you so much for participating. You can see a couple folks with their phones out still, so we'll give it another minute to see where we land here. And hopefully we haven't swayed the room too much with our presentations already, but it looks like increasing social connection is a real, and misconceptions on mental health are really resonating with you all. Wonderful, okay, so good to know. Yes, increasing social connection, misconceptions on mental health, those are really key issues that affect all of us. Don't want to miss anybody. Okay, great. We have one more question, so don't put your phone away. What's the most important resource you or your organization can offer to the coalition? So you just have to get a new QR code here, and then you can answer this question. So what's the most important resource you or your organization can offer to the coalition? And we would love to capture this as well. Can't wait to see that come up on the screen. This is exciting. And there might be more, but I didn't want to have to make you type in anything. So go ahead and select from the list. And if you have other things you could bring to the organization or to the coalition, we would love to hear about it. Hopefully we'll see those live results pop up here any minute. Looks like folks are still maybe working through. It says we have 41 people hooked into this, so hopefully it's going to pop up here any second. Maybe there we go. All right, so we've got community networks and connections, advocacy in the room. We've got lived experience or community member perspective, which is just super invaluable because what we are doing in this room has to matter, has to connect, has to make sense, has to be relevant. We've got expertise and technical assistance. We've got volunteers and human resources, training and educational programs, and I think more, although I can't see it kind of falling off the slide there. But this is amazing. This is the wealth. These are the assets. This is what we have together to be able to address these issues, and this is what is going to make a difference. So I will go ahead and go to the next slide here, and then we're going to transition over to hear from the U.S. Surgeon General's office. So the collective impact model is what we're basing this coalition around. And I just want to share a little bit on the tenets here. So transparency, really key, right? What are all these folks doing and what's making a difference? Shared metrics dashboard. We're going to measure things. We're going to see how we're doing. We're not just going to talk about it. We're going to measure. And we're going to, as we work together, as we bring those assets together, as we accomplish things together, we'll be able to celebrate that together. Project-based task forces. So this is where we're going to have folks that are focused on changing things and making things better. Continuous communication through social media, newsletters, regular meetings, and town halls, and then committed leadership. And in a little bit, we'll get into the actual structure of the coalition. You'll see that the leadership includes community representatives from the town, schools, healthcare, parents, and more, which is really key. All right, so at this point, I'm going to introduce our next speaker. So we're going to have to get connected. So we have someone coming in virtually, presenting virtually from the U.S. Surgeon General's office, who actually worked on this report. So let me just go ahead and introduce her. So Priyanka Atalay is a third-year fellow on the science and policy team at the Office of the U.S. Surgeon General. She was part of the development and dissemination efforts for the Surgeon General's advisory on the healing effects of social connection and community, which is the report that we had, the 6 pillars comes from. And she continues to play a role in the office's ongoing efforts around social connection and other key priority areas. And we're so thrilled to have her with us this morning. You may just take a second to get us started.
Perfect. Well, thanks everyone. Good morning. My name is Priyanka Atalay. It's an honor to be with you all today, representing the Office of the U.S. Surgeon General, Dr. Vivek Murthy. I'd like to begin by extending gratitude to the town of Enfield for their invitation to join today's coalition kickoff event. And I want to congratulate you on the completion of your mental health and wellness strategic plan. It's great to see the importance of social connection woven throughout that report and the ongoing work we're all engaged in. Now, while many of you here today are deeply familiar with the work of the U.S. Surgeon General, I want to begin with an overview of our office and core priorities, and then I will overview the Surgeon General's advisory on the healing effects of social connection and community that was released in May 2023, with a particular focus on the Surgeon General's framework for a national strategy to advance social connection. Now, for a little bit on our mission and core priorities here at OSG. As the nation's doctor and as Vice Admiral of the U.S. Public Health Service Commissioned Corps, The mission of the U.S. Surgeon General is to protect, promote, and advance the health and safety of our nation. The Office of the Surgeon General achieves this mission by communicating the best available scientific information on how to improve health and reduce risk of illness and injury. Work, learn, and play. We do this in a few different ways. Through written products, for example, public events, our social media channels, and our podcast house calls, to name a few. If you haven't given house calls a listen, please do. We have great conversations on there. In December 2021, our office published its first publication on the topic of mental health, the Surgeon General's Advisory on Protecting Youth Mental Health. Since then, we have released products on workplace well-being, social connection, social media, and most recently, firearm violence prevention and the state of parental mental health. These topics continue to be our core priorities today. Now, before I dive into the content of the Surgeon General's Advisory on Social Connection, I'd like to share a little background about how this report was developed as well. During his first term as Surgeon General almost a decade ago, Dr. Murthy became intrigued by the role loneliness seemed to play in the lives of so many Americans he spoke with. He realized that loneliness was not only pervasive, but was also tied to the health and well-being of individuals and our broader community. At the start of his second term, Dr. Murthy and our team began systematically collecting research and consulting with subject matter experts in the field to put together an advisory that would call America's attention to loneliness and social isolation as issues of national public health significance. Now to jump into some of the highlights and key findings from our advisory. As many of you here know, there is a robust body of evidence that shows us that social connection is a fundamental human need that drives survival and health outcomes. Even though societal advancements provide us with opportunities to meet many of our tangible needs without requiring in-person contact, our brains remain biologically wired to expect proximity to others. As such, the consequences of loneliness and social isolation are profound, and the evidence is strongest for cardiovascular outcomes. For example, evidence shows that indicators such as social isolation, poor social support, and loneliness are associated with approximately a 30% increase in the risk for heart disease and for stroke. Social disconnection is also linked to an increased risk for the development of chronic illnesses such as hypertension and diabetes, increased susceptibility to and risk for developing severe illness after exposure to viruses, and an increased risk for developing cognitive and mental health conditions such as dementia, depression, and anxiety. Now, on one hand, while loneliness and social isolation contribute to poorer health outcomes, on the other hand, social connection may function as a protective factor in reducing the likelihood of poor health and of exacerbating our existing medical conditions. For chronic illnesses such as hypertension and diabetes, greater social connection may improve disease management and lifestyle behaviors, which can reduce the risk for complications or worsened outcomes from these conditions. In terms of mental health, social connection can protect against depression even among those with a heightened baseline risk for depression. And social connection may be one of the strongest protective factors against death by suicide. The effects of social connection extend beyond just physical and mental health impacts to our broader well-being as well. For example, positive, supportive, and diverse relationships at school and in the workplace are linked to greater educational attainment and job performance, both of which can improve economic potential and income potential and economic outcomes in adulthood. Now, what might drive these profound health impacts? We found that social connection influences our health through three principal pathways. The first two are biological and psychological processes. For example, objective social isolation can increase inflammation in the body to the same degree as physical inactivity, and loneliness can aggravate the body's stress response. The link between social connection and heightened inflammation and stress may help explain the diverse health outcomes we see associated with loneliness and isolation. The third principal pathway is behavioral. Social connection can also directly or indirectly influence our lifestyle and health-related behaviors, such as exercise, sleep, and medication adherence, which in turn impact our long-term health outcomes. In addition to outlining the individual level impacts, causes, and consequences of social connection in the advisory, the Surgeon General also covers decades of research on the relationship between socially connected communities and community-wide outcomes. Evidence shows us there that highly connected communities enjoy significantly better population health, are more prepared for and recover more quickly from natural hazards, experience lower levels of community violence, have more representative governments, and are more economically prosperous. The Surgeon General's advisory concludes with a framework for a national strategy to advance social connection in order to highlight the consequences of disconnection and encourage all of us to work together to mend the social fabric of our nation. This six-pillar framework encourages collective action from all individuals and institutions across the country. I believe your coalition is already building upon these pillars, and I've heard that other speakers at today's event will dive further into each of the six pillars later on, so I will provide just a brief overview of them at this time. The first of these six pillars calls for investments in strengthening elements of social infrastructure in local communities to help to develop social connection. We must also ensure equitable access to social infrastructure for all groups, including and perhaps most especially for those at high risk for social disconnection. Pillar 2 calls on governments to recognize that the drivers of both connection and disconnection can be found in all sectors of society and not just in public health. It calls on governments to recognize and address the causes and harms of disconnection, and do so in a connection in all policies approach. Pillar 3, mobilizing the health sector. Given that social isolation and loneliness are independent risk factors for several major health conditions, as I outlined earlier, healthcare systems must enable providers to assess for social disconnection in their patients' lives and respond with evidence-based interventions to help mitigate the harms. Pillar 4, reforming digital environments. This pillar calls on technology companies to implement safety standards for their current products and support pro-connection designs for future products that create healthy environments for social interaction. Pillar 5, deepening our knowledge. This is a critical step toward advancing our understanding of the causes and consequences of social connection and toward developing effective interventions to mitigate the risks and harms associated with disconnection. Finally, Pillar 6 integrates all aspects of society and calls on each one of us to cultivate and maintain a culture of connection characterized by kindness, respect, service, and commitment to our relationships. Not only is it critical to practice these values in our own lives, but we should also all seek to opportunities to model the culture of connection for the people around us in our day-to-day. In the advisory, the National Strategy Framework is followed by a series of recommendations from many other stakeholders, many of which are present here today, including schools and education departments, workplaces, community-based organizations, and media and entertainment industries, as well as individuals, parents, and caregivers. This means we all have a role to play in building a culture of connection in our circles and in our local communities, and by proxy, our broader society. The Office of the Surgeon General recognizes that by attending today's event, each of you are actively playing a role in creating positive change to build a healthier, more resilient nation where people thrive. We value the time you've taken to be here today to help accomplish that goal for the town of Enfield and look forward to hearing more about your journey. Thank you so much for your time.
Good morning. It's a great day out there, isn't it? I want you to ask everybody that's sitting at your table, how you doing today? Because you could probably say to everybody, do you have 2 hours to give me? And we said, sure, you know? So when somebody always asks me, geez, how do you feel today? Well, I could tell them that, you know, do I want to tell them the truth? Or do I really want to just say, you know, I'm doing okay. I feel good, you know? So I was asked by Cindy a couple of days to say a few words and introduce our next speaker. And it is a great pleasure that I do that. But before I introduce our new speaker, when I look around the room here today and we talk about connections and we talk about the different groups that are here today, it's a testament to our social service department as to bringing our community together for an important event and to recognize our mental health and social loneliness. So I am quite honored to be saying a few words today. But today, it's great pleasure to introduce our next speaker. She's a graduate of Yale and Duke Law School, and she is defined by strong community values, hard work, and persistence. She is an advocate and a voice for the well-being of our Connecticut residents and our town of Enfield. She supports women and girls, small business owners, which we have several here today, veterans, seniors, our LGBTQ plus community, and the list goes on. This is the type of person that she is. When I called her and said, can you come to this event? She would drop anything to come to Enfield to say a few words and speak. She is a dear friend of mine. Some of her initiatives, and today coincides with today's conference, is opioid addiction awareness and mental health. Her Live Loud campaign and the smartphone app Nora, which gives people information about how to identify and respond to opioid overdoses. I think that's pretty important, and maybe some people don't even know about that. But that's another feather to put in another resource to use. I also today asked her to speak about her and Governor Lamont's Social Connection campaign. Susan's no stranger to Enfield, and with her roots here in town, she has been a friend to many, and many of us that are in this room here today. It's an honor for me today to introduce our Lieutenant Governor, Susan Bysiewicz. Thank you, Susan.
Appreciate it.
You're welcome.
Well, good morning, Enfield, and thank you, Bob, for that really nice introduction. It's such a pleasure to be here with all of you, and I'm glad you were hearing from the Surgeon General's office because in May of last year, they put out a report saying that loneliness is a public health epidemic and a problem akin to AIDS, to smoking, to drug addiction, and so much more. And I'm glad that the town of Enfield is taking this issue very seriously, because the governor and I are. As soon as we read the report and also connected with Senator Murphy, who you're going to hear from, I understand, a little later, we decided as a state that we wanted to try to do something about it. So earlier in the year, we launched our Social Connection campaign. I didn't want to say our campaign to end isolation and loneliness. I rather have a positive spin, right? How can we encourage social connections with each other? And we had a whole group of our agency leaders be part of that announcement, because what I learned as I talked to our other cabinet members was that almost every one of our state departments, whether it was public health, addiction services, social services, aging, DCF, Veterans Affairs, you name it, they already had programs in place to address loneliness and isolation in our state. And so that's the good news. The bad news is not a lot of people know what those programs are. And so one of our goals is to try to put together a group of resources so that folks in Enfield or Middletown or Berlin or wherever they live, or whatever age they are, they can find out what's happening at the community center, what's happening at the youth center, the Boys and Girls Club, whatever the resources are by community, so that people can reach out. And Senator Murphy and our state have been working together. Senator Murphy's got a couple of pieces of legislation which, if passed, could bring some resources to Connecticut. But I think what struck me about the Surgeon General's report is the two loneliest groups. So one, maybe not a surprise, folks over 65, right? People who are retired, so they're not working, less connections with colleagues, perhaps, you know, a spouse has passed away, so even less social connection. And among adults, 60% of adults, no matter what their age, said they were lonely. And the surprising thing to me was the young people, because the loneliest groups, the loneliest age group was young people between ages 15 and 24. And that surprised me, because when you think about teenagers, you think about students in high school, students in college, right? They are surrounded by young people, but you know this, they're also like glued to their phone, and I'm guilty of it too sometimes, but I think our State Department of Education that put out a policy for phones to be put in pouches so that kids can focus on their schoolwork. I can't tell you how many teachers said, that's great, because it means that kids will be paying better attention, there's less bullying going on, and kids are much better behaved. So, you know, those are the upsides to putting the phones away, and I think it's better for kids' mental health, but also it's better for social connection, because if you're not glued to your phone during lunch, and good job on the lunchtime program, nobody eats alone, but when kids are together, then they can focus on building relationships with one another. One of the problems that we see, especially with young people, is, and it was just reported on this earlier this month, that we have had already 11 youth suicides, kids 17 and younger, and that's up from 6 last year. I know, and you know, when you think about the impacts on people's health, the Surgeon General said that if you're lonely, it's the equivalent of smoking 15 cigarettes a day. I don't know how many cigarettes are in a pack of cigarettes because I don't smoke, but that sounds like almost a pack of cigarettes, right? So you can imagine, and you can see it, in our youth suicide rate. And it's a problem too. Suicide is a big problem for our older white men. You know, every year in Connecticut, we have about 1,000 deaths by gun violence, right? And when you say that, a lot of people say or think it's young people of color in cities that are dying by gun violence. And there is too much of that. But what you might not realize is 2/3 of the people who die by gun violence, 2/3 of that 1,000 are older white men, mainly veterans, who are committing suicide. So this is why this issue is really important to address for our young people and for our older residents. And one of the problems with, especially with veterans, is a lot of our veterans have weapons from the military, and they're in our homes. And that's why I really want to make sure that people understand a new law that has gone into effect this year that is that could impact our young people. And that law says, it's an expansion of Ethan's law, and it says that if you have a gun or ammunition in your home, those two things need to be stored separately and locked away, because the problem is if other people in the home have access to it, you have issues. So when we started the school year, our leaders in our Department of Education and I, and public health leaders, wanted to make sure that our schools are reinforcing that with parents. And if you're a parent, when your child or your teenager goes over to visit a friend, you should be asking, hey, do you have weapons in your home? And if you do, are they locked and put away so that young people can't access them? Because had that been the case, Ethan's song would still be with us today. So I just want to say that I am so very grateful for all the leaders who are in this room trying to brainstorm about how we can make sure that our kids' mental health is better. I think there's a much bigger focus on it. We have one of the best youth mental health laws in the state, but there's such a need for more mental health professionals and social workers in our schools, so that our kids, if they're having issues, can feel like they can reach out and get the help that they need. It's good to see the Connecticut Collaborative to end loneliness here. They've been an incredible partner for Senator Murphy and for the governor and I, so we applaud all the great work that you are doing. And I look forward to doing anything that I can to partner and collaborate with all of you so that our kids can be healthy, both physically and mentally, and that gives us all the best opportunity to make our future brighter and better. So thank you so much, and it's an honor to represent you every day in Hartford. And Enfield's having a week with the governor here yesterday and me here today. It's a great opportunity. Thank you so much for having me. I appreciate it. Put this back. I'm just going to give that to you.
Okay, hi everyone. My name is Tessa Rydell, for those who I don't know. I hope you're all enjoying all the speakers so far and that you've learned a bit. So next we're going to hear from Deb Bibbins from Connecticut Collaborative to End Loneliness. So that is a nonprofit organization that aims to connect generations, inspire action to end loneliness, reduce ageism, improve mental, physical, and social health for people of all ages. So recently, the collaborative has started a Connecting Connecticut conversation series. And so that aims to kickstart the conversation around isolation and loneliness using a panel of people with lived experience and professionals as well. And I had the pleasure of attending one on Wednesday. It was really great. And Deb is also a Connecticut resident who aims to improve her community and the lives of people of all ages. So thank you, Deb.
Good morning, everyone. Really, really thrilled to be here. I think everything that is taking place here in Enfield is very inspirational. I can tell you that I lived in Enfield for a number of years, and it feels really nice to be back. And I really just want to applaud this diverse, connected community of people coming here together today to talk about something that is vital to each and every one of us. So as Tessa mentioned, I am Deb Bibbins. I am the founder and CEO of a Connecticut nonprofit called For All Ages. And For All Ages, as Tessa mentioned, is dedicated to connecting the generations and inspiring action to end loneliness, reduce ageism, and improve health. And the three words that I want to focus on this morning of our mission is the and inspire action. So as we were out since 2019, when we founded the organization, talking to individuals, holding programs and events that bring community members together in various parts of the state, what we heard over and over again is, we need more of this. And can you come to us? And how do we get engaged with you? And who else is doing this? And when we had conversations with clinicians across the state, they said, you know, we know this is a problem, but we're not quite sure what to do about it. We know it's a problem, but we don't want to ask because we don't know what the solutions are. And if a patient presents himself or herself and says, yes, I'm lonely, we don't really know how to handle that. And so in 2021, we took a step back with our board and an advisory council and said, okay, what can we do about this? Recognizing that we are a small organization doing really powerful work, but it's very episodic, and that we need more and more of this, and how can we connect with others? We dreamed up the idea for the Connecticut Collaborative to End Loneliness back in 2021 and put it on pause until our U.S. Surgeon General declared loneliness a public health crisis last year, as you all have heard. We launched the organization a year ago, really aimed at 5 pillars, very similar to the Surgeon General's pillars, but the first of which is, let's talk about the importance of social health and social connection. I think it was Kate that said this morning, ideas and concepts are caught and not taught. And that really resonates with me because that is what we are doing as collaborative members across the state. So one of the first things we're doing are these conversations where we are truly pulling together groups of municipal leaders, leaders of various community organizations, members of the public. We've had lots of college students engaged and involved in these conversations to talk about what is the problem, how do we define it, how do we come up with common words to talk about it. One of the things that we have found is that what resonates with people is the concept of social health. So the idea is that it is the dimension of our health and well-being that comes from connection and community. And social health really is the foundation of both our mental and physical health. And so if you're thinking about it as a building block, right, you've got social health as the foundation. And if our social health is lacking, then one or both of our mental and physical health will also be lacking. The other area that we decided to forge ahead on over this past year, because you've got to start somewhere, right? So we're talking about conversations to improve social health literacy and to reduce the stigma of loneliness and get people comfortable saying the words, right? And so what we know for sure is that there is a negative stigma. And what we want people to understand is that loneliness really is no different than hunger. That when you're hungry, it means you need food, right? You go and you open the refrigerator door and you get yourself some food and you have lunch. And when you're lonely, it simply means you need social connection, positive social connection in your life. It doesn't mean there's anything wrong with you. And I think the more that we can talk about it in that way, the better off we will all be, and we'll be able to help each other improve our social connectivity. We've also pulled together a group of clinicians and others who are talking about screening for loneliness during annual physical exams. And we are hopefully engaged with the Lieutenant Governor and others at the state to pull together this, I'll call it a database, it's not a sexy term, but a database of opportunities, municipality by municipality, that are already available, right? So we know that there's lots going on and a lot of people simply just don't know about them, right? We don't know about the opportunities. We also know it's not enough and we need to create more of those opportunities and we need to do it together. And I love the fact that you have named this organization what you have and the whole concept of together, because it's very meaningful. We did a pilot in another town this spring. And what we did is we reached out to community organizations in town and we said, will you send 3 people to 3 social health literacy programs, each 90 minutes long, and will you commit at the end of those 3 to create and hold a social connection event in town? We had 5 organizations step up and say, yes, I want to be a part of this. And so we did that. We held 2 social health education events in town. The third of those events was a working event where we taught people how to build a positive social connection event where people can feel a sense of belonging, where they are invited to be there, where they can share their authentic self with others. And we had an overwhelming response and the ideas that were created. So, I'll share with you, the town was Simsbury. We received some funding locally to host these events, and we said, just wait and see, and just let's watch and see what happens. We had the local Rotary decide to start a dinner each quarter for people that have no one to have dinner with and who sit home alone because they are solo, living their life alone. And the first event, we had people from 3 generations come out. More than 30 people raised their hand and said, yes, I want to be a part of this. And at the end of the event, they said, when are you holding the next one? Because I want to tell someone about it, and I want to bring others. And so that's just one little seed from the Rotary. This past weekend, we had a group of high school students who were one of the groups that came to this social health literacy program, partner with the Aging and Disability Commission in town, who reached out to the library and a local ice cream shop to hold what they called, and they dreamed this up, they designed it themselves, a Sweet Connections event. They had high school students at each table who were conversation starters for whoever showed up. There were more than 60 people that signed up. The event filled up. And to me, what was most powerful was 98-year-old Loring, who drove himself to the event on his birthday, who walked in and said, it's my birthday. I have no one to celebrate with. And so I thought I would come here. And so what did we do? We sang him happy birthday. And so I say that because it's powerful, right? If we can all take small steps of connecting with other local groups within Enfield, and then holding these, I'll call them simple events. Didn't cost a lot of money. The ice cream shop donated the ice cream. The high school students developed the conversation starters. The library had the space, right? The cost was minimal, and the reward and the impact was phenomenal. So those are the types of things that I hope you all are thinking about. I hope that you can be inspired to be dreaming up these creative ideas to bring people together. I will say that as the convener of the Connecticut Collaborative to End Loneliness, we are really hopeful that a decade from now, the organization won't need to exist. We're really hopeful that we can make the impact and bring people together and get various towns and municipalities engaged so that everything is taking place and it's just by routine, right? It's a matter of course. And a decade from now, everyone locally will be responsible and engaged and being a part of making their own town more connected. So I really applaud everything that Enfield is doing. And what I would say is, how can I help? I'm here to help. What Tessa mentioned when she said, how do you want me to introduce yourself? And I said, well, just say that I am a Connecticut resident, really looking to help other Connecticut residents. I've lived here my entire life. I've attended the public school system. I graduated from UConn twice with 2 different degrees, and I'm here to help. And so I hope you'll take me up on that. So thank you for your time this morning.
So Deb was giving you some very cool examples of what happened in Simsbury, and she reminded me, and I just wanted to share some things that bring young people and older people together. So here's one program at Central Connecticut State University. They have a program that matches retired people in specific professions with young people who are studying those things, accounting, whatever. And the young people, the students, would meet once a week with older people who have been active in engineering, whatever the field was, and they became friends and mentors. And a lot of the students that did that, and since we're in Asnuntuck, and I think we probably have folks from the senior center, I thought I would mention that program, because the older people look forward to connecting with a younger person, and then that younger person found a friend and a mentor. So I wanted to raise that. Also, high school students, and this one really terrific high school student that we know from Granby took a group of his friends, high school friends, and they came to the Capitol, but he's done this in his hometown of Granby, and made beautiful happy birthday and other kinds of greeting cards for folks who were in nursing homes. So it was a really cool, creative event with lots of young people making beautiful cards for seniors. Another fun thing that Eric Russell and I did, Eric Russell is our state treasurer, we got a group of folks from the Bloomfield Senior Center and young people who wanted to learn about financial literacy. And we had this conversation with seniors and middle school to high school about financial literacy, and we were asking some of our older folks to give younger folks advice about what are things they learned about money and financing that they wish they knew when they were teenagers. And the kids and the older folks had a great conversation. So I know you have a very active senior center, so I'm gonna just volunteer Eric Russell and I to do that if you want, with students and older folks. So those just give you a few other fun ideas in addition to the Simsbury one. Like, I love the Rotary and the ice cream example. So I don't know if I took the mic away
No,
from you,
that's
but I'll
okay.
give it back to you.
Thank you. Thank you. This is wonderful. So I think this is how we spark ideas for one another, right? And you know, if you go out onto the For All Ages website, you'll see some of the programs that we run. So think about For All Ages as an organization that runs programs and events and also focuses on the Connecticut Collaborative to End Loneliness. Our most impactful program, we've now had 600 people go through it, including Enfield residents. We connect a Connecticut college student with an older adult for a weekly phone call during the college semester. It's our Tea at 3 community. It's totally free. We have 90 people across the state participating this fall. And so there's so many ideas that I'm sure you all have. I'm happy to brainstorm ideas with anyone afterwards. So thank you.
Thank you so much. This is so exciting. I hope you're inspired, because I know I am. At this point, it's my pleasure to introduce Lucas Smith from B. Smith Whalen Consulting. This consulting firm has worked in Enfield for about a decade, leading the youth survey and other surveys that provide valuable local data from which we can do planning and really understand what needs to happen locally. So, welcome, Lucas.
So we talked a lot about the power of social connection. I'm gonna tell you, I was a little tired when I got here. I was a little anxious, and this gentleman held the door open for me, changed my mood a bit. First face I saw was Cindy, changed my mood a lot. Then I got to sit there alone and watch presentations, and my fine neighbor looked at me and said, "Are you nervous? Are you anxious?" And I looked at her, and what do you do when you have no answer? You just smile. She says to me, "I know you're nervous because your leg's been shaking all morning." So there's no earthquake happening. My leg was shaking like crazy over there. But the ability to stand up here and say, "Hey, listen, I'm anxious, I'm a little nervous," like, I'm not of that generation. I couldn't say that 20 years ago. I can say that today. Because there's language around it. Like, it's okay to be nervous and anxious, but it's not about me, but it is about all of you and this community. And we use these surveys to listen to these communities. I'm Lucas Smith. It's no coincidence, although Smith is a common name, that I'm the CEO, lead analyst of B. Whalen Smith Consulting. That is my wife. I spent the first 20 years of my career in the world of investment management. And through that, I learned a lot about data and how to manipulate it and how to use it. My wife knew I had those skills. So what became, fairly infrequent, like, "Hey, Luke, can you help me with this? Hey, Luke, can you help me with this?" became much more frequent, to the point where I said, "All right, like, let's just end the song and dance. Like, yes, I will become your lead analyst and dive into this head first." So data's data, right? Like, investment data spoke to me, but it was soulless. I did my first survey, and I got emotional. And I will probably get emotional today, because these are voices. And the voices speak, and sometimes they yell. So I will point out where the data yells at us. And the youth voices, we all have youth in our lives, like, youth can yell. They yell in this data. So What I'm going to cover is 3 surveys that targeted 3 very specific groups in the Enfield community. The first one is Enfield Youth Voices Count survey, which is our product that we administered in 2023. And we had 2,139 middle school and high school participants participate in that survey. Now, they were a captive audience. They were in a classroom. They were asked to take the survey. They did not have to take the survey. They could have sat there and left it blank. In the town of Enfield, I think there was 52 surveys that I threw out because there was no response. That is uncommon and unbelievable to get 2,139 active participants in a survey. We also did the Enfield Adult Survey, trying to reach a broader population, and then the Young Adult Community Survey, trying to reach a population of 18 to 25-year-olds. So we are now going to go into some of the data here. Now, this is pretty broad, what I'm going over. I can go as deep as people want. Like see me after, ask me questions. Like there's a lot of depth to the data, but we're going to go over it pretty broadly here. Just real quick on youth surveys. We've been doing this now for about 7 years. I think there's about 55,000 youth that we have heard from across the state of Connecticut. And having spent the time in that data, like there are some themes that come out regardless of community type, regardless of suburban communities, rural communities, urban communities. There is some themes in the data that I will highlight. So we'll go right into the Youth Voices Count data. This is the 2,139 middle school and high school students that we studied in 2023. John F. Kennedy Middle School and Enfield High School, and it touched on youth lifestyle, substance use, mental health, bullying, and the related risk and protective factors. It's critical for me to reinforce how anonymous this data is. We really try to drive that message home. We have surveyed in our own community where my own daughters have taken this survey. I wish I could see their responses and identify them. I cannot. We really make that clear to the kids so that we get the purity of their voices. And the best way to do that is these instructional videos. A lot of communities will have a popular teacher. The teacher everybody loves will just do a quick 5-minute video for all the kids. We've had other communities use like a peer leader, just introduce, this is why we're doing this survey, this is what we seek to do with the data, and that definitely moves the needle. And you'll see it in the next slide. Well, hold on, I went the wrong way. Right here, Gold Star. 82% of your 6th to 12th graders participated in this survey. Great number, because that tells us like we got a nice tight confidence interval around what they're telling us. Like we're hearing their voices accurately. Some of you might notice this trend downward in response rates. Not an Enfield issue. This is what we see across all communities. As kids get older, they tend to participate less. But having 70% of 12th graders participate, and I think this was near the end of the school year, pretty huge. I think most teachers would tell you that's like the depth of engagement for youth. Gaming assets and consequences. I'll go through this one really quickly because let's tell you the top 3 gaming assets and consequences were connection and credibility. Like I feel like I earned credibility for my play with my peers. And interestingly, loot boxes. We always look at loot boxes because that's often the introduction to gambling. My son's a gamer. The loot box never has what he wants. The first one never has what he wants. They try to incentivize you to buy the second, the third, the fourth, the fifth, to keep rolling to get what you want. So we look at that data very closely because it's usually a precursor to gambling. Social media, everybody's favorite. Like, what are the top 3 things that this population is getting from social media? They're feeling connection. They're feeling better about themselves, but they're also seeing things that are inappropriate. What's interesting is, we ask it both. Do you feel better about yourself? Do you feel worse about yourself? This right here, 9 to 12 graders in all communities, it spikes. You feel worse about yourself. You use social media more in the high school population. and then largely consistent with the other groups. Let's talk about emotional health. We already talked about anxiety. Well, 33% of Enfield youth report almost always or always feeling anxious or nervous in the past year. That's 1/3. Now I talked about data speaking and then data yelling. Every single one of these questions that was asked, we look at it across the facets of biological sex and race and ethnicity. When we look at this data by biological sex, the female youth are screaming at us about anxiety, screaming. Like, it's alarming how elevated it is for females relative to males. It's yelling at us. The sources of this anxiety are academics, post-high school plans, schedule, and then, you know, when we see it, high school, as you're getting closer to these decisions, anxiety really elevates. Schedules get tighter, but peers is pretty consistent, whether you're middle school or high school. Like, peers have a very, very strong influence on you, on anxiety levels. This was the first question I ever studied in a survey where it got hard. 290 kids that we surveyed, 14% of them have considered suicide. And you can see it in thoughts of self-harm and actual self-harm and sadness, sad and hopelessness. Like, this data screams when you look at it by biological sex as well. It yells at me every time, every community. Just an interesting note, physical abuse, intimate partner, over the last survey season, that is starting to spike out more for males than females. Males are experiencing physical abuse more than females, which really surprised me. So that's something to watch. Now let's talk about a little bit of substance use. This is lifetime use of substances. Probably to no one's surprise, it's the big three: alcohol, marijuana, and vaping. What I'd really want to highlight here is just the blue bars are your high school population. The green bars are your middle school population. Like, numbers explode. They blow up in the high school years. The good news is this is lifetime use. Have you used this substance in your lifetime? Is the core of the question. The next question we ask: in the past month, have you used these substances? Again, in the past month, it's the same three, but gambling's starting to creep up there and encroach on those core three: the marijuana, alcohol, vaping. So gambling is coming up there, and again, you see the same trends between the left bar is your 6th to 8th grade population, fairly low use rates, and then they start to balloon up in the high school years. So this is all 2023 data, one point in time. So, like, let's put it in the context of time. And, told you, like, my 20 years of experience in investment management, downward sloping lines you never want to see. It's usually not a good thing. But the beauty of this world is these are great. Downward sloping lines in this world is incredible. This is incremental effort year over year, planning year over year. 2017, Enfield listened and responded with programs and efforts to address what they heard. They listened again in 2019. They did the same cycle again. They listened in 2021, and same cycle, 2023, same cycle. I hope to get a chance to see the 2025 data. I know you're thinking of listening again. This is what you're looking for. Like, you are absolutely moving the needle, and it's great to see, and it should be obvious to all of us how that needle's moving. It's like this room, this event, the people, how we're engaging with the youth. It's working. Go into a little bit of ease of access. This is a little less exciting to me, not because of the numbers, it's just, you know, ease of access. This is very hard, sort of hard. Like, how hard are these things to access? Here, the lower the number, the worse. It's like easier to access. You know, it's alcohol and vape products are what become much easier to access in later school years. Where are substances acquired most often? So I'm going to call back. Just remember some of these numbers because they're going to show back up in the other surveys that we did with the larger groups. 15% use marijuana at home with their parents' knowledge. So 15% of the student survey, marijuana at home with their parents, and 41% alcohol with their parents' knowledge. This is without 38, with 41. Without knowledge, marijuana 25, 15% there. So those, you know, like we can control our homes for the most part, but that's something to watch out for because we know, like friends and peers, we have less influence on as they get older, but definitely our role as parents and you know households definitely critically important. So a lot of questions in the survey, and through analysis we can kind of generate a profile of like what a substance user in Enfield, like what their experience has been, and that's the next slide. A lot of words here, but this is your Enfield middle and high school youth that have used any substance in their lifetime are more likely to get less sleep. They spend more time at home alone. This one's really important. Like, they don't have one adult they can share their thoughts and feelings with. They don't have, like, they can't do what I just did, say I feel anxious. Like, they don't have that person in their lives. They don't feel safe in their community or at school. They've been bullied. You can go on through the list. You know, sad or hopeless, considered suicide, feel less comfortable seeking help. They don't have clear rules around substances, and so on. And this, you know, this kind of profile we see in a lot of communities. It's fairly consistent. So it's just it's fairly powerful as you start to really dig into the data and kind of create these profiles. So that was the youth survey data, 2,139 youth. We're going to start now going into the adult and young adult survey that Enfield did. So this was targeted again. They wanted to widen the net of who they're listening to. They felt confident about what they were hearing from the youth. They want to hear from older youth, 18 to 25, and then the broader adult population. That was the intent of these next two surveys, and in the same time frame as the Youth Voices Count survey. So pretty consistent time frames. Talked a little bit about this, just how they did it. Like, this is legwork. Like, it's easy for me to survey student population because they're in school. Harder for you guys because they have to be, the people you want to hear are probably not out in the community, especially talking about loneliness. You're going to be real hard to hear from a lonely person because you're not going to get them at the senior center. But, you know, maybe they vote, you know? So they really were very strategic in how they reached these people and got, you know, really good responses. And they got responses with no incentive. Nobody was incentivized to complete these surveys. They just did it because they were asked. As Nantucket Community College played a great role, be able to get 18 to 25-year-olds. And then this yielded about 400 responses that we're able to study. This is the profile of like what these responses looked like. This is a bit of a marketer's dream. You know, we get a lot of 18 to 20-year-olds, 36 to 45, 46 to 55. We'd love for the future efforts to get a little bit more here, and then definitely here. This is hard, but it's definitely in view. And then this thing, this females participate more. All surveys, whether it's substance use, mental health surveys, any survey, you're going to get females participate more than males. We see it everywhere. So definitely a predominance of female responses, but within the bounds of what we would expect. Then we look at it by race and ethnicity and just see, hey, are we getting what kind of matches up to our census? Are we reaching the broad population? And using this data, we can see that you are. Cast the net, are we reaching people in Enfield? Yes, you're reaching people in Enfield and more. These are other communities that, we collected data from as part of these two surveys. Now, this is interesting because it's so consistent with the Youth Voices Count survey. Alcohol, marijuana, and binge drinking. Binge drinking is often spiked out as 4 or more drinks in a constrained time period. So again, this kind of dovetails with the Youth Voices Count data. Like the kids we surveyed in 2017 are now the 18 to 25-year-olds in this population. So those problems that they had then tend to persist. And you can kind of see the consistency in the data here. Again, this is lifetime. Similar theme for past month. Again, alcohol, marijuana, and binge. And then we spiked out the young adults separately, because you can see, 17% of the total sample versus 28% of young adults for marijuana. So marijuana is elevated for the young adults relative to the broader population. And then vaping, it's almost 3 times as much for young adults. And interestingly, alcohol was lower for young adults versus the total sample. Age of initiation, this matters a lot, because we know if we can push the further out these numbers get, the better the outcomes. So it's an important measure to look at. This is how it kind of shook out for this survey. Again, this is what we see. It usually starts in cigarettes, are the first things kids can get their hands on. Vapes, prescription drugs in the youth data is usually way up here. But then it's alcohol, marijuana. We don't ask about cocaine for age of initiation in our surveys, so we don't have that data point, but I would expect if we did, it would be something later in life. But the further out these numbers go, the better, because you're kind of protecting that developing brain. Substances used in vape products. So what are people using in vapes? Well, young adults, you can see, it's marijuana, nicotine, flavored liquids. I wish we could do a separate study on this something else. I have no idea what that could be. If anybody has any idea, what you could be vaping that's not in these first 4 options, let me know, because I'm curious. Very curious. So these are percentages, right? But I'm going to go back, because it's a point I wanted to make. Where was it? That's going to come up later. Sorry, guys. I thought I went over it. Let me get back on track here. Okay. Be driven under the influence. 20% of young adults have driven under the influence of marijuana, and 16% under the influence of alcohol. So that's the risk-taking kind of age there, but relative to the adult community, clearly, yes, I am driving under the influence of alcohol and under the influence of marijuana, loud and clear. And then consequences of substance use, similar story. Has your substance use negatively impacted or interfered with your work, life, or relationships? 20% in the young adults, yes. Have you lied to people who are important to you about your substance use? 25% in the young adults, yes. And then you can see the lower numbers for the larger population, the broader adult population. Now, why are they using substances? So there's some consistency. You can look at it, adult community, young adults. There's consistency in why. The difference for the adult community, why they did it when they were younger, comfort, to be more comfortable in social situations, and then for the young adults to have a good time. So that's the two differences we saw between those two populations. In the last year, why have you done it? I want to highlight two things. For young adults, to help deal with anxiety, depression, mental health issues. 62% selected that, and boredom, 53%. So this is where I start to see, and you know, nobody coordinated presentations together. We heard about loneliness from another data set, like 3 different surveys in the same community, like it's triangulating on an issue here. Why do you limit your substance use? Top reasons for the young adults, bad for my health. Family history of substance use problems, that's pretty powerful, like recognizing, like, hey, I've seen this play out in my own family, I don't want to participate in that. And interesting to me is illegality. I don't see that often. Like, often young adults are not afraid of the consequences, especially legal consequences. But in this community, it was a top response. Peers. Like 13.5% versus 4.5. Like that to me, when I see big differences in the numbers, like it makes me curious. So peers clearly play a big role, as we all know, in young adults' life and decision making. Anxiety in the past year, like here it is again. 40% of the young adults, 40% are lonely almost every day for 2 weeks straight. 35% are sad or hopeless for 2 weeks, like 1/3. And half of them, anxiety greatly impacts their life. Big numbers. This one, thoughts of suicide. We evolve our survey every 2 years. Cindy's work in this survey influenced our evolution in our own survey about how we ask about suicide and kind of evolved to say, okay, tell us more. Cindy did that here in this survey, and 13% thought about it, whereas 12% in the adult community, 2% of the adult community made a plan, 5% of young adults made a plan. And then you can see the attempts are elevated for the young adults. 5% of the young adults have made a plan. They've not just thought about it, they thought about it and said, this is how I'm going to do it. Receiving help or support, I like this one a lot. Because what you'll see is the most accessed resource, mental health concerns with therapist, inpatient, outpatient, right here. And then the same mental health concerns with a parent, close family member. They got the help. 25% got the help they needed here. 14% got it here, but there's also these two numbers here. Like, I needed it, but I couldn't get it. So there's like maybe some capacity room there to grow. But it is, there's two sides to every point. This is great. This is great. Like they're accessing it, they're using it. It's available. And I think most importantly, like they knew they needed it. Because I'm fairly sure there's some people in that no, I did not need it response that probably don't know that they needed it, but it is good to see people responding to the fact that they did need it. Use of prescription medication for mental health, adult community versus young adults. Have you taken it because it's prescribed to you? 1/3, that feels normal, just anecdotally. Young adults, if you take medication prescribed for someone else, well, twice as many are taking someone else's prescription medication versus the adult community. community connectedness. This one, I didn't know how much time I was going to have, so I was kind of highlighting slides as I focus more on. This was the big one. Lots of highlights on this one. Because young adults over here, I feel connected with my community, strongly agree, disagree, way up relative to the total sample. So they don't feel connected, strongly disagree with that. Flip side of that, do you feel lonely or isolated? Look, I strongly agree, and I agree with that. So there's a relationship there. Like, I don't feel connected, I'm lonely or isolated. Now, knowing that would potentially be an outcome from the data, we asked about attending events. So this is a lot of data. It's really hard to kind of get it to tell a story because there's a lot of information here, like social gatherings in Enfield, outside of Enfield, versus community events in Enfield, outside of Enfield. This participation rates. Looked at it quickly. It's about once a month. People are doing social gatherings over the course of a year in the adult community. Now the next slide is the young adults. If I overlay them, you can see these nuns are huge relative to the adult population. So young adults in the past year, attendance and social gatherings within Enfield or outside of Enfield, predominance of no's, and then much more so in community events. So the nice thing about looking at multiple surveys is you can kind of look back at other data that was captured. So they asked parents and guardians, what's the most important thing you can do regarding use of alcohol and marijuana? Well, remember those other numbers, using it at home and parents' knowledge? Well, 13% said no, I don't think it's a great idea. Or it's a lower priority to provide it in a safe place for someone under 21. Well, 40% of kids, were using alcohol at home with their parents' permission. I think it was 35%, 20% maybe, for marijuana. So there's a disconnect there. This is, these questions here were asked just of people who have kids or children, grandchildren, ages 12 to 20 who live in Enfield. Do you have clear rules for your kids about these substances? And, you love to see the 90s for yes. This connects with our Youth Voices Count data. We do ask that question, do you have clear rules for these substances? And the numbers are very, very similar. The last time you talked to your children and grandchildren about the risks of substances below, what I want to highlight here is never prescription drugs. Prescription drugs you focus a lot on, even though the numbers are often small for use rate, because if I make a mistake vaping, I can recover from it. If I make a mistake with marijuana, I can recover from it. If I overuse a prescription drug once, sometimes it's a one-time thing. So even though the numbers are small, and that's why it's important for me to always remember, these are voices. Even though the numbers could be small, it's still a person telling you something. And with prescription drugs, we really focus in on it because it's unrecoverable. This is, we tied this back to our Youth Voices Count data. It looks the same. How wrong do you think it would be for youth to do the following substances? And then we asked the kids, what is your perception of your parents' disapproval? And these are great numbers. 92% of the Enfield youth are yeah. It's very, very clear to me my parents have disapproved of alcohol, 93% for vaping. Marijuana, anecdotally, is going way down. Not just in Enfield, across. I looked at 50,000 responses to these survey questions. I have pretty, it's now innate in me, what to expect to see. In marijuana, the perception of parental disapproval of marijuana is decreasing significantly year over year. This is what I want to highlight. You look at this is a breakdown of who these students were for young adults only, full-time students, part-time students, just a slice of demographics. But this 50% of these kids do not have a regular, consistent place to sleep. So it just, to me, it's like one of those things where it's like, well, you kind of look at the smaller numbers and recognize, like, that's a person, right? Gaming. So this is interesting because how much time they're spending gaming is, you know, fairly large. Like about a third of the kids are spending, on average, more than 2 hours a day gaming, and 10% of kids are spending more than 30 hours a week gaming. Like 30 hours, it's kind of like a part-time job. But why are they doing it? Like, more than a third of them are doing it because they want to escape or forget about real life problems. So it's something to watch. And then gambling here, you know, not a lot of activity. It's less than monthly, but 12% of the kids have felt the pressure to gamble more and more. So it's something we want to watch because we are seeing the gambling numbers, as we mentioned earlier, and the youth data increasing more and more. And then this is just how you heard about the survey. Just this is all the legwork to get responses. This is where the legwork happened and how it shook out. So, you know, in conclusion, like what's the take home is you guys got a lot of resources, you got a lot of data. The data tells us a lot. It's refreshing to work with Enfield because of the cycle of listening, responding, listening again, responding again. Like that cycle yields results, which you saw in those downward sloping lines. So I hope you feel good news about what we went over. And again, it was a lot of data we went over, and we went over like 15% of what we got, like even just on the Youth Voices Count data. So we got a ton of information, and we have a ton of information on the whole state. So it's nice to look at Enfield relative to other communities as well. But Enfield stands out. You guys are doing awesome, awesome work, and thank you for having me.
You have a few minutes if
I do.
anyone has questions or comments, like what you take away when you see some of the data, if you have any clarifying questions. It is a lot of information all at once.
Yeah.
Some of it very sobering, like you said, screams at us.
Yeah, it does.
Will you be sharing that? Is there a place we can access that?
Yes,
Yeah.
and so we have our ETC website, says thank you for that. On your tables, there's these little cards. QR code gets you to the ETC website. We are in the process, I'm sorry. We'll continue to upload the reports that we have. So we have many years of the youth survey, and then the adult and young adult community. This was our first year doing that.
Yeah, and we did have some questions about the data, like sharing it. Like we're very democratic with, like, the confidentiality for students applies to communities. Like if Ellington said, hey, can you show us Enfield's data? Hard no. But if Ellington was like, hey, can you show us suburban community data? Yes, like we're very democratic with that. But anything very specific to Enfield, like that, it's Enfield's data, so.
I just want to say that the data that we're seeing in Enfield that was just presented is similar to the data that we're seeing in other towns. And when we go and talk to young adults, what they are saying to us is, we're looking for opportunities that give us a sense of purpose and that where we can serve our community. So youth and teens are looking for these opportunities to get connected. And what we hear is, we don't know where to start, or they don't exist. And so I think there's a huge upside potential to working with the teens in Enfield to say, here are opportunities for you to have a sense of purpose and to help with the community. So I just want to point that out.
Yeah. Anything else?
Does any of this ring true from your vantage points? Because you all represent different sectors. So yeah, resonating.
Yeah. It's,
And Dr. Kalman, you were going to say something?
No.
Oh, okay. Sorry. That's all right. All right. Any other last minute observations, thoughts? You do, I should have said earlier, on your tables, there's, I think I did say at the beginning, index cards. Please jot down any thoughts, questions. What the leadership work group has been doing is sharing data that they have from their agencies and organizations. So we are going to be collecting that local data, which is really, really hard to come by. So Enfield has a significant advantage because of the partners coming around the table and being willing to share. And sometimes that does make people uncomfortable because we want people to feel that the data individually is anonymous, but we do put it together to help us keep that cycle and the loop of, we got the data, we need to review it, what's our response, how are we doing? And so it is an iterative process.
And one point I do want to make is when you start cutting the data up, you do start to get to some small numbers. Like, I'll use an example. It's like Asian students that have been bullied. There might be 7 in a community. Like, that's a number you won't go out there with because it could be very easy to identify people. So we're almost like we're religious about the confidentiality throughout the whole process. I think I'm introducing Chris Bronson. Sorry, we have a question.
I'll take one more question and then, I'm going to ask our town manager to speak.
It's not a question, it's just a quick observation or comment. And so my name is Chris Gummo and I work for Enfield's Kite, and we focus on children primarily birth through age 8. Obviously knowing that these young children do not live in a bubble. And I think when we see the data, it's typically starting 6th grade, the middle school, the high school, down to age 12. But I think you're seeing more and more of the mental health struggles in younger and younger children. So I think it's important to say that being part of the leadership work group, we've all talked about what that looks like for those younger folks, because there really are issues around infant and young children's mental health, which we do know correlate right through family success and through healthy families, healthy adults, to which we see the data that you presented today. So I think that although we might not see that younger generation specifically in those data points, that it's important to know that we are having conversations around these young children, because the foundation that we build with our youngest citizens is truly what can set them up for success in life. Physical health, mental health, it's all part of the healthy child. So I think that part of that conversation going forward, it's important to mention that to me is a piece that, although it appears that it might be missing a little bit, is really being a strong part of the conversation. So thank you.
Thank you.
Yep, thank you.
Good morning. Thank you, Lucas. I should be Bob Crissati. We're at the mid-morning sort of like zombie stage, and I should start to clap hands and jump up and down and yell, but I'm going to be the good guy to give you a break for about 10, 15 minutes before the senator comes, if you indulge me for a few minutes. I'd like to thank everybody for coming. This is just an incredible event. I'm so proud of everybody who stepped up to the plate to be here, from all of your organizations to our council to the Board of Ed. These folks, they're just invaluable in making these ideas and these policies actually come to fruition. They're the ones who fund these programs, who fund the groups to combat these issues we've heard about this morning. A lot of sobering information that came out this morning. Sort of took me by surprise a little bit. I didn't know I was probably in the most vulnerable group where I'm going to be shortly. 65, white male, and hopefully live to retire. So I was listening more carefully after I heard that to see. But like all of these things, we don't know. Everybody in this room, including me, our families, we have all experienced addiction, alcohol, drugs, suicide, loss of loved ones. This affects us all. As Bob said, how you doing today? Great! How you really doing today? We don't know. It's like a marriage, right? Only the two in the marriage know what really is going on. So it's important and incumbent upon us to do these things to help. And I'm going to tell you why it's so critical. Yesterday, as the Lieutenant Governor said, we had the governor here for a business breakfast. We're trying to reward the businesses, expand businesses, bring new businesses in for basically our residents, but also to help with the tax base. The whole rest of the afternoon yesterday, for 5 hours, we had a job fair, a huge success, over 50-something vendors. So we brought businesses in. Now we're bringing employees to those businesses. Later in the morning, the governor had an incredible press conference at Stowe, where he announced with his Commissioner Bai the new rules to allow families, you're making $65,000, your children are in daycare, you're doing well, and at work they said we're gonna give you $1,000 or a $2,000 raise, and all of a sudden, you lose the daycare, it's a $20,000 bill, so what do you do? So there's gonna be a cushion of about $20,000. Of course, the mayor and the governor and the mayor's grandson, Julian, stole the whole show. If you go online, you want to see that beautiful little grandchild who's at that facility. And what the mayor said really rung true with the governor. After he said, we talk about policy, we see these things, but to hear somebody whose family has actually gone through it and benefited from it, he said it makes my heart. So today is the next phase. All of those things we do are really, we work all day, right? We go to work, we come home. A former manager, Matt Koppler, once did a group for, brought in a speaker for the directors. And I was a director, then town attorney, or one of those roles I had, because as you know, right, Cindy, I've been here 35, 36 years now. But what the fella said is we work all day, we do it, Monday through Friday, family, and then at the end of the day or on the weekend, what do we want to do? We want to do the things that make our souls sing. Right? That's what we do all the rest of it for. And that's what this is about. We're going to take care of the jobs and the businesses, but now we've got to make sure we have mental health and wellness in our community so that everybody can enjoy, everybody can benefit. So I am going to conclude by thanking the tri-chairs, Kelly Fisher, Charlotte Riley, Mayor Ken Nelson for stepping up. They do it in addition to all of the other roles that they have, all of the other responsibilities and duties. I see these counselors and the Board of Ed members, night and day, weekends, the amount of time that they put in to their community is staggering. People really just don't understand that, and I hope folks at home, we recorded yesterday and today because I want the folks of Enfield to know the commitment of you and your elected officials, state, local, and federal, to their well-being. And I think it's a real testament. I thank everybody for doing it and for stepping up, and in a few, I hope Senator Murphy arrives. This is good because if I've forgotten anything, now Cindy will tell me. But I'd like to do a special thank you to Cindy. I get to claim credit for hiring her, right? And what a heck of a job she and her staff do. And I thank them, all of them, yesterday, those here today. They really care about us and they keep us safe. And the chief and our EMS, they keep us safe in one way in our fire departments, right? But the others, the internal struggles, what we, our demons, that's what all of they help us with, and we thank them from the bottom of our heart. So network a little walk around. Cindy, I'm sure we'll get a...
Kate's going to tell us a little bit more. So yes, we're stretching, waiting. The senator's right on time, which is 11:30. And so
And I know you'd love nothing more than to hear me go on. But I'm going to take my leave. Thank you very much. Take a little break and enjoy the rest of the program with the senator. Thank you.
Right.
All right, folks.
For when you don't have
Please take your seats.
know.
Senator Murphy has arrived. Boy, that's a quick hush. Much better behaved group than yesterday. Well, again, I'm Chris Bromson. It's my great honor and privilege to introduce our Senator Christopher Murphy. I've had occasion to work with him over the years in my capacity here in Enfield. He's always been a friend of Enfield. And look at him. He does these walks across Connecticut. He's svelte. He looks like a teenage young man. He's ready to fight for his third term in the Senate. It's interesting from my perspective because working in a municipal capacity as I do, I see folks come in, maybe they join a Board of Ed or Wetlands Commission, they go to the council, and perhaps they run for state rep and maybe state senate and beyond. And it's good because it's a real learning experience for them to know what goes on local. I think all politics are local. Everything actually comes down to the local level. I really believe, Senator, and I shouldn't say it, all the money should be decided at a local level because we know best how to spend it. He's on the appropriation committee, so he knows how to bring it. We always know how to spend it. But I want to tell you, what I mean by this is Senator Murphy, he didn't just become a senator. Today we had a lot of people who are successful businessmen or they're, well off and they want to make their, their contribution. But Senator Murphy did it the old-fashioned way. He did 8 years in the General Assembly. as a person listening and going to Hartford in his community. He makes his home in Weathersfield with his wife Catherine, his 2 sons, Owen and Ryder. And so he's always stayed connected. And then he went to Congress, so he expanded his sphere, and he went to Washington. He brought what he learned from Connecticut there, and he did that for 3 terms. He's had 2 terms in the Senate. He's on the Appropriations Committee, where he's used that position to bring back to Connecticut the funding we need for brownfields. We discussed it yesterday. He's been integral in that, to renew communities. He's been very active after Sandy Hook in that legislation. As we heard earlier, he has some legislation which is directly impacted on what we're discussing here today. He can discuss that with you. But it's just so heartwarming to have somebody who gets us, who's one of our own, and I wish him all the best in the future. And with that, I give you our junior senator, Christopher Murphy.
Well, my mother would be very happy to hear me being introduced as Christopher. So she always says that she would have never named me Christopher if she knew that that was going to turn into Chris, which of course it was going to. Great to be here with you all. I've been really looking forward to coming here and being able to talk with you and to you for a few minutes, because this effort that you are relaunching and reinvesting in, man, it's so badly needed. It is so badly needed. And you seem to have figured out all of the different components of mental health and wellness. And not everybody has across this country. So the work that you're doing here in Enfield to really understand this holistic picture of what we need in order to keep our kids and adults safe and healthy, I'm really grateful for it. And I'm equally interested to be able to hear how this project turns out, because I think you're setting up a model about how to invest in community and resiliency and hope. So yeah, it's true. I have done every job there is to do in public service. Chris didn't give me credit because I started out in local government. So I was in the state legislature, but I started out on the Planning and Zoning Commission in my town. And then I quickly figured out that if I wanted any future in politics, I had to get the hell off the Planning and Zoning Commission. Because local government is hard. Because to do the job right, you tell people no a lot. And you're telling tough truths to your neighbors, to the people your kids go to school with. And so I'm grateful to all of the local leaders who are in the room here, because this project you're invested in, it takes the federal government, the state government, the local government, and then it takes community partners. Let me tell you why this is so special and important to be here with you today. I have spent a lot of the last 2 years really trying to challenge myself to think in a big way about the mental health of this country. I spent 2 decades involved in mental health care. I was the chair of the health committee in the state legislature when we reorganized our mental health delivery system and our Medicaid program. When I got to Congress, I dove into the issue of mental health care, was one of the people that wrote the Affordable Care Act, and then in 2018, I wrote a big piece of legislation called the Mental Health Reform Act, which was the biggest revision of our mental health laws in a generation, established a lot of new, really important programs that we fund, improving, for instance, the training pediatricians get in mental health care, set up a whole new office at the Department of Health and Human Services dedicated to mental health. We never had an assistant secretary in DHS that worked just on mental health and addiction. We now have that. That bill established new requirements for insurance companies to pay mental health benefits, because as you all know, when you try to get reimbursement for mental health, you often get red tape and bureaucracy thrown in your face that you don't get when you're trying to get reimbursement for a orthopedic procedure. So I'm really proud of the work that I've done, we've all done together, trying to set up a medical system that responds to people's mental health crises. But the deeper I got into this world of mental health, and frankly, the deeper my family got into the work of mental health. My family has a history of mental illness and addiction, like many other families in the state do, the more I realized that this was a bigger conversation than just about the medical system. That we've built a culture in this country over the last 30 to 40 years that has pushed people into lives of isolation, has allowed them to withdraw from human connection, has put them in a position where they care a little bit less about the community and their neighbors than they used to. And I started to ask myself, well, are there roles to play for government to try to address this crisis of loneliness? Because there is a crisis of loneliness in this country. You just look at the statistics and the self-reported studies, there are more people who are telling us that they feel disconnected from their community, that they feel alone than ever before. And you don't have to dig really deep to figure out why that is. Here's some stunning, you've probably gone over this already today, so I'm probably telling you stuff you know, but this is the stuff that motivated me to get into this space. In the last 30 years, the amount of time that we spend with friends and family in person has declined by 50%. So for kids, they were spending pre-pandemic about 150 minutes a day with their peers. Right before the pandemic, that's 2003 data. Right before the pandemic, 150 had gone to 90. And after the pandemic, 90 had gone to 40. Right? So in 20 years, the amount of time kids spend with peers went from 150 minutes a day outside of school down to 40 minutes a day. Adults been cut in half. Here's some other really scary statistics for you. In 1990, 25% of Americans say that they have 3 or fewer friends. 1% of Americans say they have no friends. Fast forward to today. 50% of Americans say they have 3 or fewer friends. 12% of Americans say they have no friends. Right? And so it is not to me a coincidence that during this period of time where people have started to withdraw, that we have seen rising rates of self-harm, rising rates of trauma, rising rates of political instability, rising rates of addiction. And I don't think government has the answer to all of the crisis of loneliness. There are just some things happening in our culture that are different. But we have some of the solutions. Listen, part of the reason that I and Dick care so much about regulating social media is that these things have become a poison. They really have become a poison. Especially if you're somebody, especially if you're a young person that maybe doesn't have the social skills that other kids have. It becomes a real excuse for withdrawal. What we've learned during the era of smartphones is that virtual connection is not the same as in-person connection. It does not stimulate your brain and your heart in the same way that being in physical proximity with someone is. And so I'm a big believer in real tough, strong regulation of these devices, especially for our kids. I think that may be one of the most important things that we can do to put kids back in touch with each other and maybe set some habits in those developmental years about the importance of being together with peers that ends up helping them as adults. The second thing I think government can help with is leisure time. We have a crisis of leisure time in this country. More people have to work multiple jobs in order to make ends meet. Today it takes 70 hours of work to get the same quality of life for your family that 40 hours of work would have gotten you just 30 years ago. And so part of finding connections, having the time to find that connection, to be able to join a bowling league at night, to be able to spend some of your weekend at a church, involved in a social group. But people don't have that any longer because wages are not allowing people to stop working at 40 hours a week. So to me, why I care about raising the minimum wage and why I want to make sure that work pays is not just for economic reasons, but for health reasons as well. People need to have time off. And then lastly, and this gets me to talk about what you asked me to talk about, the Silo Act. We've had a real crisis of institutions. Church membership has plummeted. Fewer Americans belong to unions. The places, what people would call third places, right? Not your work, not your home, the third place where you meet friends, where you find companionship. They're all weaker than they were generations ago. And I do think that there's a role for government to play to try to make those institutions healthier, give them a shot at keeping their doors open. So I gave a speech a couple months ago to a religious organization in which I sort of made the case for why government should care about the health of churches, but also why government should care about the health of labor unions, and that there are institutions on both the right and the left that are pretty weak today, where people sort of learn selflessness, where they learn to care for others, where they find friends that need to be healthy in order for people to be healthy, and the government can play, not a definitive role, but can play some kind of role in making those places alive. The Silo Act is a piece of legislation that I've introduced that would put money into the area agencies on aging to particularly support institutions that connect senior citizens. If you look at sort of the increased rates of loneliness in this country, it's mainly young people and senior citizens. But with local budgets stretched so thin today, it is hard to be able to protect that money for the senior center, to grow the services, to make sure it's open the kind of times and hours that you want, to build the transportation that allows seniors who don't have it on their own to get to that place, to fund trips so that your only option isn't just to come and sit in the lunchroom at the senior center, that there are things the senior center is doing to open your horizons and give you the chance to experience new things with your neighbors and other seniors. So the Silo Act sets up a new fund that would send money directly to the area agencies on aging that they would use to combat social isolation and loneliness amongst our senior population. And I think that would end up supplementing a lot of the efforts that you're undertaking here. I'm hopeful that we'll be able to get that legislation across the finish line. I've also introduced, I'm sort of a co-sponsor of that bill, but I'm the prime sponsor of a piece of legislation called the National Strategy for Social Connection Act. And what that bill would do is to set up a coordinating council inside the White House that would be thinking about social connection strategy every day. We have these metrics that we use to decide whether we're doing a good job. The unemployment rate, GDP growth, kids' test scores, the crime rate. Those are all really important factors. I care about all of them. But when you look at longitudinal studies about happiness, what actually makes somebody say to a surveyor, I've led a fulfilled, meaningful life, a happy life, the results are pretty irrefutable. Not to say that career and how much money you make doesn't have an impact on that, but every study that judges at the end of life what you determined made a happy life was relationships, connection to your community, a feeling that you were part of something bigger, right, than just your own story. And so why I wanted to set up this new office, the Office of Social Connection, is to actually start being able to collect data on whether or not government is doing a good job at giving people the access to the things that actually say that matters most to happiness: connection, friendship, community. This is a bipartisan effort. I've just done a bunch of work with a Republican senator, deeply conservative guy, Pete Ricketts from Nebraska, who's invested in the exact same question. So the good news is that a lot of this work, most all of this work, doesn't fall along partisan lines. We can have a lot of bipartisan cooperation around just making sure the government is doing some things to supplement your efforts to help people find connection and community. And I hope it's bipartisan because, it's right there in the original challenge to the federal government. The Declaration of Independence, right, has this radical line in it in which it says individuals have a right to pursue life, liberty, and happiness, right? A right to life, liberty, and the pursuit of happiness. The document, our founding document, says happiness in it. That's a radical idea. And so the work that you're doing here to stitch together a community that not only has the services that you need when you're in mental health crisis, when you have a diagnosable illness for individuals in recovery, but also that's setting the kind of foundation for health that's necessary. Institutions and neighborhoods that allow people to connect with each other, that sort of pull folks out of this cycle of withdrawal that we're in. That's the route to happiness. And my government, our government is supposed to care not just about GDP, not just about the unemployment rate, not just about crime rates, but about people's wellness. It's in the founding documents. So I was just so excited to come here and be a part of this because I think you've got it right. I know there's a lot of hard work to do. I know it's difficult when you sort of see the full picture because the full picture is so enormous and sometimes it feels like you can't do it all. But I'm here to cheer you on and I'm here to help. Hopefully we can pass the Silo Act. Hopefully we can deliver some new resources to communities to help tackle loneliness and isolation, specifically amongst our elderly community. Hopefully we get this social media regulation bill passed so that kids have a shot at connection. If we can turn off this poison that's in their pocket. And then hopefully you'll come to me after today and the work that you'll do as you relaunch this initiative and say, Chris, I've got 2 or 3 more good ideas about what you can do to help us build a healthy foundation for Enfield for the state of Connecticut. So I know the last thing to do is your call to action. I'm eager to hear it so that I can be a part of it. And I just want to thank you for what you're doing and for the partnership that we'll have. Thanks, everybody. Appreciate it.
Thank you. Well, this has been an amazing morning. It has flown by. I can't believe we're already at the call to action. But I just wanted to give you all, as you all are invited, you all are here, you all have a part and role to play, a little bit more sense of the roles that we have in the Enfield, the ETC Mental Health and Wellness Coalition. So I'll just go here. So here at a high level, we have a leadership work group, which is led by tri-chairs, which we introduced earlier, representing town, school, and community, which meets monthly. And this group is committed to prioritizing initiatives, finalizing decision-making, and allocating funding. And then we have the lived experience and content expert advisors, and many of you in this room also fall into that category, where you are bringing your own experience, you're bringing your professional experience, you're bringing your community member perspective to inform and guide and support the work of the coalition. And so you'll be invited to weigh in on different initiatives at these leadership work group meetings. And then task forces. So as you can imagine, these are the folks that are really going to help carry out some of the work. And so we heard from Deb Bibbins earlier about these ice cream socials, these simple ideas. They don't take a lot, but they do take some committed time and effort and planning. And so we'll have folks involved at that level as well. And then interested community members. So we want this to grow, right? We want people to take on this whole idea and passion. Could you imagine if more and more people had this mindset that, hey, I can do something about connectedness, isolation, and loneliness right in my neighborhood, then how this could grow. And so these are the different ways that the coalition will carry out its mission. And some of you are already plugged into the leadership work group, the lived experience and content expert advisors, and we'll be coming into forming task forces over the next few months. So Tessa, at a practical level, Tessa will be reaching out to you to follow up with next steps and invite you to come and share and support and participate. The leadership work group does meet monthly, so we will meet again in October. That'll be the next meeting. But as we wrap up here, I do want to leave you with a challenge. And I'm going to go back to our pillars here from the U.S. Surgeon General around building a culture of connection. So I think each of us, hopefully we're inspired today, hopefully we learned something, hopefully we feel a sense of purpose, and that this work, well, it is work, is possible, right? We already heard some great reports of things that are being done across Connecticut. So I leave you with this challenge. To today, as we said earlier, much of this is caught and not taught. So what can you do so that those around you can catch the values of kindness, respect, service, and commitment to one another? How can you model these values in your own positions of leadership and influence and expand the conversation on social connection in your own schools and workplaces? So as you head into your weekend, please think about who you can reach out to, who you can connect with, who might be lonely or isolated in your own sphere of influence, and start to make that difference. Thank you so much. It's been an honor to support you this morning, and I just applaud you for all this great work. Thank you.